Hi, and welcome to today's video. You hear me say over and over again to patients that calluses are not skin problems, but pressure problems. And on our video today, we have 4 patients who have calluses in the exact same spot that we're all in on the same day. So I thought, what an opportunity. I put them all together. And all we can try to do for these calluses is to help keep the weight off of the spot where the callus forms on the bottom of the foot, and you'll see how we do that with some padding. And so I hope that you enjoy our video today. Okay, so will it ever actually go away? Probably not, although there are some things that you can do that can help. So these are not a skin problem, they're a pressure problem.
Yes.
So the bone right here is getting more pressure than the bones adjacent to it. And so in a healthy person, when you get too much pressure on the skin will thicken.
I have to tell you that I have been having a hip problem on the left side.
Well, that would make perfect sense.
Somebody said maybe you're walking different.
Absolutely.
And so maybe, like you were just saying, that's exactly what's going on.
Right. How long has this been a problem? Since your hip started hurting? Or?
Uh-huh.
Okay. So the other thing we can do is I will put a little pad in your shoe that will help take some of the pressure off of this spot.
Oh.
And so it won't stop it from coming back, but it should allow you to walk a little more comfortably for a little bit longer period of time.
Okay.
So if it's been a year and a half since we've seen you, then obviously, you've been doing okay with the care that the nail tech is giving you.
Yeah.
So we can just have you come in on an as-needed basis.
Okay, that's what I did this time.
Okay.
I just felt it was time for a refresher, or however you want to word it.
Right.
Yeah.
Okay, so yeah, I can get a little bit deeper in here than she can, and that will take a lot of the pain away. But you're still walking how you're walking.
Yeah.
And this spot...
I'm going for a cortisone shot this afternoon.
Good. Hopefully that'll take care of it.
That might help me.
Yeah. If I press on that now, does that feel pretty good?
A lot, yeah.
Okay.
Big improvement.
Yeah.
Already.
Okay, and then...
And then I've got these crazy things.
Yeah, and you had a little teeny one down here.
One down there. Yeah.
Yeah, and these are just little teeny plugs of thick skin. Really kind of the bane of the profession, because there's no way to get rid of them for good usually. Sometimes we can, but it's like walking with a little piece of gravel in your skin.
Yeah.
Okay, and then on this spot,
she sands it down only to a point.
Well, for the ones that are more diffuse like this, I'm not, even with my blade, I'm not going to probably get a whole lot deeper than she does. But the ones that have that little core, like the other one, that I can definitely go deeper.
I see. Okay, thank you.
Yeah. How long ago did that left hip start bothering you?
Maybe 6 months or so much.
You're welcome. All right, so when it's been going on for a long time, you can usually feel right where you're getting a lot of that pressure. And then I just mark it on the other side. And then we can put a pad like this around that spot to take up all the pressure around it.
Okay.
And because it's on the bottom of the liner, it won't curl up every time you put your foot in and out.
Oh, very good.
Yeah. So, yep, right there.
Yeah.
Okay. Great. So that should help make it take a little longer to come back, maybe.
Okay. Thank you so much.
You're welcome. All right, so
What do you call it?
it's Dr. Nail Nipper. I wasn't very creative with the name.
Dr. Nail
Nipper.
Nipper. That's pretty good.
Now, this is always going to come back because this is where you carry your weight.
Yeah.
It's right under that bone there. So what I'll do is I will put a pad on in your shoe that will help take the pressure off it. It's not going to completely stop it, but it will help it.
I just bought some, for these shoes, a soft pad which has a small arch in it because I'm turning this foot ankle in all the time.
Mm-hmm.
So I can see it when it wears on shoes, and that's probably has a side effect.
Very possibly, yeah. All right, so that should feel a lot better now.
Yeah.
All right, so this has been a very common place today that I've trimmed calluses. You're my third one today coming in for callus, just right here. Now, does your orthotic have a little depression under this spot?
Yes.
Okay, so we've done what we can, and this will always come back, but the goal with the depression in the orthotic is just to see if we can make it take longer.
Mm-hmm. Yeah.
So this was 3 months. What have you been doing for this in between visits?
I'm using my grater.
Okay.
Has it changed much?
No. No. You know, it's just that core in the center is kind of hard for you to get.
Yes, exactly.
All right, so got that little core out. Let's see this side. Nah, very little here. Almost, really nothing. All right, so let's just have you keep using the orthotics, keep running. And this was 3 months, so given how it looks today, I think that would probably be fine, yeah. Okay.